You're welcome to my channel. We are still on acid-base balance, but today I'll be focusing on causes of acid-base disturbances alone. This will form part 3 of 7. In respiratory acidosis, we'll be dealing with carbon dioxide or carbon dioxide retention, raising the value of the same. That means there is hypoventilation. The affected individual is not breathing well. With the decreased pH, hypoventilation, and CO2 retention, we are battling with respiratory failure. The probable causes of respiratory failure leading to hypoventilation and retention of CO2 and now acidosis could be opiates, barbiturates or benzodiazepines, Guillain-Barré syndrome, amyotrophic lateral sclerosis, myasthenia gravis, botulinum toxin, asthma, COPD, wrong mechanical ventilation, sleep apnea, brainstem damage. Others could include fever, infection, sepsis, or shock. In heart failure, particularly end-stage heart failure with metabolic acidosis, trauma with chest pain, phrenic nerve injury, myopathy, or tumor. Other causes of possible respiratory acidosis will include electrolyte anomalies, spinal cord injury, hypothyroidism, pulmonary embolism, epiglottitis, croup, atelectasis, obesity, rib fracture, pneumothorax or pleural effusion. Now, respiratory alkalosis. Here, the CO2 level is low. That is, carbon dioxide is low. The pH is high. It means this individual is breathing very fast, hyperventilation. Causes of respiratory alkalosis could include anxiety, panic attack, pain, hypoxia, pulmonary embolism, pneumothorax, excessive mechanical ventilation, high altitude, stroke, seizures, fever, and central nervous system disorder. In metabolic acidosis, there's low level of the pH, decreased pH, bicarbonate ion level is low, and base SS is also low. When we calculate the anion gap, we may have increased anion gap metabolic acidosis, normal anion gap metabolic acidosis, or low anion gap metabolic acidosis. Don't worry, there'll be a separate presentation for that. Causes of metabolic acidosis could be increased acid secretion, increased acid intake, decreased gastrointestinal loss of acid, renal failure, renal tubular acidosis, increased bicarbonate ion loss with a drop in bicarbonate ion level, Addison's disease, diarrhea, ileostomy, proximal colostomy. Causes of increased anion gap metabolic acidosis could be carbon monoxide, aminoglycoside, methanol, uremia, paraldehyde or paracetamol, INH or ion, lactic acidosis, ethanol, ethylene glycol, aspirin, diabetic ketoacidosis. Low anion gap metabolic acidosis is rare. As a matter of fact, most hospitals will query the laboratory technologist when the outcome of the lab investigation is pointing towards that. So most of the time it is as a result of lab error. But it is found in hypoalbuminemia, also in monoclonal gammopathy, in multiple myeloma, polyclonal gammopathy, lithium or bromide containing medications. Metabolic alkalosis. This is an increase in pH, increased bicarbonate, and increased base excess. Causes of metabolic alkalosis will include vomiting, diarrhea, diuresis, either loop or tarsitis, heart failure, nephrotic syndrome, liver cirrhosis, cont syndrome that will retain sodium and lose potassium, and of course milk alkali syndrome. Other causes of metabolic alkalosis is hypokalemia, renal bicarbonate retention, volume depletion leading to increased retention, nasogastric tube suctioning. Mixed acidosis, that is mixed respiratory and metabolic acidosis. Here there will be low pH and there will be low bicarbonate and there will be raised carbon dioxide or carbon dioxide retention. This will occur in multiple organ failure or in cardiac arrest, cardiorespiratory arrest. In case of mixed alkalosis, that is respiratory and metabolic alkalosis, there will be increased pH, there will be raised level of bicarbonate ion, and CO2 will not be retained, the value of CO2 will drop. So mixed respiratory and metabolic alkalosis. That will occur with diuresis, liver cirrhosis, hyperemesis gravidarum, and COPD with hyperventilation. With that, I've come to the end of this very presentation, marking the end of the third presentation out of 7. Thanks for listening. Remember to share, remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it.